Life is very precious. The sign of being alive is the continued pumping of your heart. When your heart stops beating, you can get into a cardiac emergency. A medical emergency may occur at any time to any person. As per the World Health Organization census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. As per WHO, approximately 4,280 out of every 1 lakh people die every year from sudden cardiac arrest in India alone. The concerning change in recent times is that the onset of heart disease is now seen at a younger age, especially in people who are in their 30s and 40s. The biggest reason for heart-related deaths is the lack of awareness as to what needs to be done in cardiac emergency. Every adult should know which conditions qualify as heart-related or medical emergencies. The best one can do is to learn beforehand the actions required in case of a cardiac emergency. Life-saving techniques such as CPR give you the power to save a life. It has been proven that bystander CPR improves the rate of survival by almost 50%. It is even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save life. Dr. Pawan Goel, Senior Interventional Cardiologist, the Heart Clinic, Bareilly, Uttar Pradesh. Dr. Ankesh Kumar, Consultant Cardiologist, Fortis Hospital, Shalimar Bagh, Delhi. And Dr. Rajeev Kumar Gupta, Interventional Cardiologist, Rajiv Healthcare, Kanpur. Let's get straight into our discussion. In the present scenario, there's an increase in heart attacks in the Indian population. What are the risk factors that are associated with a heart attack? Dr. Pawan Goel.
First of all, I would like to thank NDTV for inviting me on this forum. The heart attack it depends upon the age, and multiple risk factors are there. Most commonly are diabetes and hypertension. These two risk factors itself cause most of the cardiovascular diseases, that includes heart attack and brain attack. Brain attack is a stroke. So by modifying these risk factors, diabetes and hypertension, we can decrease the risk of the heart attack. Besides this, abdominal obesity, high cholesterol levels, that also are quite a good risk factor for heart attack. Coming to the other lifestyle modifications, like patient is having smoking. We have seen patients in the young age group that are only the risk factors is smoking. So smoking has to be quit at any cost. Besides, high level of alcohol intake is also being seen to be associated with heart attack. The lack of exercise, sedentary lifestyle, it is recommended at least we should go for 30 minutes daily for the walking. And besides this, the post-COVID era, we are seeing patients developing this heart attacks. These psychosocial stress, depression, patients have lost jobs, and due to this, there is increase in these risk factors of heart attack. We are seeing they are coming.
All right. Now, many people think that all heart conditions are the same. Are heart attacks, heart failure and cardiac arrest are the same? Dr. Ankesh Kumar.
No, all heart conditions are not the same. Like you mentioned, heart attack, heart failure and cardiac arrest. These are not the same. These are the different conditions with the different cause and different treatment. Often people use these terms synonymously, but these are the different conditions. Heart attack happens when blood supply to the heart muscle decrease or either block, either because of the clot or blockage in the coronary artery or spasm in the coronary artery. And heart failure happens when heart fail to pump enough blood to the body, so body did not get enough blood. These are the circulatory condition, whereas the cardiac arrest is the electrical malfunction of the heart. Is the arrhythmia condition where heart suddenly becomes stop malfunctioning in beating. So because of these, the patient can die suddenly.
So, Dr. Pawan Goel, what are the pre-existing conditions that may increase the risk of cardiac arrest?
Yeah, cardiac arrest, 60 to 70% cardiac arrests are due to cardiac cause, that is mostly the heart attacks. Rest are due to non-cardiac cause like drowning and drug overdose. So, coming to the risk factors that are associated with heart attack, as I have already told, diabetes, hypertension, smoking. Besides the patients in less than 35 years old age group, hypertrophic cardiomyopathy is a most common cause. It accounts for at least 48 to 50% of cases of sudden cardiac arrest in patients with less than 35 years of age. In this, there is a disease of the muscles of the heart. The muscles are quite enlarged and they are more prone for developing this ventricular arrhythmias, ventricular tachycardia and fibrillation that are the life-threatening, and that causes this cardiac arrest. Okay. Besides this, unusual left ventricular hypertrophy is a common risk factor. Congenital coronary anomalies in which their coronary arteries are abnormally arranged since birth. Besides myocarditis, myocarditis is the inflammation of the heart, which we have seen in the COVID era also. Myocarditis was the most common cause of cardiac death. And this dilated cardiomyopathy, in which case the heart function of the muscles is functions of the heart muscles is quite low, which prones the patient for the ventricular arrhythmias and thereby death. And besides these arrhythmias like long QT syndromes, these can also cause this sudden cardiac arrest. More than 35 years of age group, more than 80% patients develop the sudden cardiac arrest due to this heart attacks, and that are having the pre-existing coronary anomalies, the deposition, fat deposition. Besides, in coronary, this heart attack, we must know the golden hour. First hour is the golden hour in which the maximum rate of sudden cardiac arrest, ventricular tachycardia, fibrillation occurs. This is the golden hour in which we can save the most of the patients if they reach the hospital on time. The other causes are like dilated cardiomyopathy that I have already told. This aortic stenosis, this is the abnormality of the valves in which the valve is abnormally constricted. And hypertrophic cardiomyopathy is a rare cause. That's other causes.
Okay, now while not all heart problems show the same signs and symptoms as in movies, some indications are worth noticing and contacting your doctor about. How does a person know if he or she has a heart problem? Dr. Rajeev Kumar Gupta?
Yes, firstly I want to congratulate NDTV for bringing such a good initiative. As we all know, young heart diseases are getting more and more younger nowadays. And so early recognition is very important. There are certain symptoms which can suggest that the person is having heart disease, particularly in adults. If a patient is having chest pain, which is associated with increased sweating, ghabrahat, dizziness, nausea, or if the patient is having chest pain on exertion or without exertion, and it is radiating to both the arms or the left arm in particularly, or to the back of the chest, he may have heart disease, and that is suggestive of any heart attack. The patient can also have shortness of breath with or without exertion. He can have a fatigability. He can have palpitation, irregular heart rate. He can have a vertigo simply or a pre-syncope or syncope. These are suggestive of heart diseases. In particularly in patients who are diabetic, who are elderly, particularly females, and those patients who have underwent coronary artery bypass surgery previously, they may not have a typical chest pain, which is usually seen in the other normal persons. So if they have any sort of dizziness, this also signifies that the patient is having heart disease. Similarly, in case of pediatric age group, if we consider that infants and children, if they are getting blues discoloration of lips, nail beds and feet, particularly on crying, if they are having history of frequent chest infections, if they are having history of palpitation, if they are having history of syncope on mild moderate exertion, if they are having the feeding difficulties, such as if they are having shortness of breath during feeding, if they are having increased sweating during feeding, that is suggestive of congenital heart disease. So whenever these sort of symptoms are there, one should immediately consult a cardiologist. So these are the basic symptoms which one should know that he or she is having a heart disease, both in the adult as well as in the pediatric age group.
Okay, but you know, CPR is a life-saving technique. What should a person check before giving CPR, Dr. Ankesh Kumar?
Yes, CPR is definitely life-saving technique. Other person suffer any kind of cardiac arrest because of the cardiac causes, circulatory causes, arrhythmic causes, or non-cardiac causes like drowning, respiratory arrest. In all kind of cardiac arrest, CPR is always life-saving if performed properly. A person who is performing CPR should first check whether environment is safe or unsafe for the patient who suffer cardiac arrest. Check for the patient is conscious or unconscious. Most of importantly, we should check for his pulse and breath, whether there is pulse is there or not. It gives the idea of circulatory state of the patient, whether the patient is breathing or not. So he required respiratory assistance also.
Okay, now, which should be the first step when you are at a scene where a person has collapsed? Dr. Rajeev Kumar Gupta?
Yeah, whenever a person collapses in front of you, the first thing you should do is to assess the safety of the surrounding. For example, if the patient has collapsed in the middle of the road, you should immediately shift him to the side by so that you can do all those emergency procedures or emergency things such as CPR or giving breaths. You should shout for help if you are alone, and if you two or more than two rescuers are there, then you should ask the second person to arrange for AEDs or other emergency services. You should also quickly reassess regarding the breathing as well as the pulse of the patient, and you should activate the emergency service, which is particularly the phone number 112 in our country, or any emergency ambulance service which is present in your locality. Please assess the breathing as well as the pulse. And if you're not able to feel the pulse and the patient is unconscious, just start the CPR. In case breathing is there and pulse rate is there, just monitor the patient until the emergency services arises. If supposedly pulses, you are able to feel the pulse, but there is no breathing, please give rescue breathing every 6 seconds after. That is, around 10 rescue breaths should be given over a period of 1 minute. And if no breathing or pulse is there, which you can just acknowledge by placing your hand on the front of the nose or just feeling the pulse, then start the CPR. If a one rescuer is there, then you have to compress the chest by giving a high quality CPR, and that should be 100 to 120 chest compressions per minute, and in between with a strength of that, the chest wall should compress around 2 inches in case of adults. And whenever the AEDs, that is the automated external defibrillator, arrives, you should assess whether the rhythm he is having is the shockable or non-shockable. If it is shockable, immediately you have to defibrillate the patient, continue the CPR for 2 minutes, and then assess the pulse. Or as soon as the emergency services arises, then you should shift this patient to the nearby hospital or the emergency ambulance. In this way, the bystanders or the persons who are witnessing a patient collapsing in front of them should act.
All right. With that, we'll take a very quick break, but we'll be back with more on this discussion. Stay with us. Welcome back. Now, will chest compressions alone revive the person or restart the heart? How should these chest compressions be given? Dr. Pawan Goel?
Instead of just being a lay bystander, doing nothing, one has to try to start at least with the cardiac compression so that patient can be saved. Though it is always a preference to go for cardiac compression and rescue breathing, but if you can alone do the cardiac compression, because cardiac compression is the mainstay in the CPR procedure. So cardiac compression has to be given whosoever is there at the site till the emergency personnel with the automatic defibrillator arrives. So how to do a cardiac compression? First, place your one hand over the other, and first and foremost, we have to save the place. Patient has to lie supine on his back. The chin has to be elevated. See for any obstructions in the mouth, and then start with the cardiac compression. For cardiac compression, one hand has to be laid over the another, and with the elbows to be straight. There must be no bending of the elbows. You just place your hands, both hands like this over the center of the chest below the nipple line, and you have to push and as hard just to depress 2 to 2.5 inches of the chest, and fast. Fast means at least 100 beats per minute to up to 120 beats per minute. So it is said push hard and fast. If the second square is also there, he should start with the rescue breathing, closing the nostrils and do mouth to mouth breathing. Till this emergency personnel arrives with the automatic defibrillator, we should continue this cardiac compression, because cardiac compression can save a life. Alone it can save a life.
Okay, now should a person who is though not well trained in CPR try and attempt CPR? What happens if CPR is performed incorrectly? Dr. Ankesh Kumar.
Well, person who is not well trained in the CPR, any person can do CPR. He should do the CPR, whether he is trained or not trained. It's always better to do something better than doing nothing. A person who is well trained should start CPR with the 30 compression with the 2 rescue breaths. Person who is not well trained, he should start doing CPR without delaying the time. He should do at least 100 to 120 compression in a minute without rescue breathing. If he is having any bystander, tell him to call for the help. So that trained person will arrive. Till then he should continue the CPR. And what happens if CPR performed incorrectly? CPR, as I already told, saves the life if performed correctly. Sometimes if imperformably performed CPR result in some danger to the patient. A patient who is had cardiac arrest may remain dead if CPR performed incorrectly, because of incorrectly performed compression lead to poor circulation to the patient. Patient may not survive. And sometimes vigorously performed CPR leads to the trauma to the patient. Rib fracture can occur, which lead to the injury to the lung and sometimes injury to the heart. Air in the lung, pneumothorax. Sometimes blood fill the lungs, pneumothorax can occur. Sometimes abdominal and cardiac injuries also occur because of the incorrectly performed CPR.
Now, what are some of the key steps to be taken by people to keep their hearts healthy, Dr. Rajeev Kumar Gupta?
Yeah, as we all know, the old saying, prevention is better than cure. So if you follow a healthy certain steps, you can just prevent yourself for getting heart diseases. Example, you should do a daily exercise, yoga and meditation. A brisk walk of around 30 minutes per day over a period of around 5 days per week. That is a total of 150 minutes per week. If you do a brisk exercise, this walking, that's quite enough. You should refrain for taking junk foods, fatty and oily, and you should do a daily meditation. You should just check control over your weight. You can restrict intake of salt and sugar, and you should also refrain from smoking and other addictive activities. Also, one should take a good quality of sleep. That is very important because it serves to relieve the stress. And last but not the least, what I personally feel is that to be happy is one of the most important things because it relieves the stress, just maintain or fine-tunes your internal beauty of the body. And that's why I personally feel that just music or doing some, just learning some instruments could be one beneficial step in this way. Because what I feel is that if you love your family, just take care of heart. And if you love yourself also, then you should take care of the heart. So these are some basic steps which one can follow to just prevent himself from getting any sort of heart disease.
Now, should you perform CPR on someone who's struggling to breathe? Dr. Pawan Goel?
CPR is not recommended in patients who are struggling to breathe. If patient is not breathing or patient is just gasping, in such cases you have to definitely start with CPR. First, cardiac compression has to be started after seeing the vitals, and this rescue breathing has to be started.
Okay. Now, can you fully recover after a cardiac arrest, Dr. Ankesh Kumar?
Yes, patient if correctly, timely perform CPR, patient can recover fully. It's the whole matter of time. When what's the delay of the time? If correctly and timely perform CPR, patient can recover fully. Because because of the blood supply to the brain is very important. Timely perform CPR leads to the timely blood supply to the brain. Brain vessels are very sensitive to blood supply. If we correctly and timely perform CPR, so neurological status of the patient remains intact and patient recovers fully. Sometimes delay in the CPR result in the neurological.
All right. Many thanks to all three of the doctors who joined us here on the show. With that, we're taking a very quick break.